Hello everyone. Today in the topic of medical microbiology we are going to study about spirochetes. The main objective of this topic is to give a brief introduction about spirochetes and what are the diseases that they cause. And the outcome will be you will understand the prevention of disease caused by spirochetes. So as you know, the spirochete is a very different type of microorganism or bacteria, right? So, spirochetes generally refer to bacteria with a spiral morphology ranging from loose coils to a rigid corkscrew shape. So, although the meaning of spirochete is also the shape of corkscrew, and its shape is really very different from other type of bacteria, and it is very easily identified because of its shape. The three medically important genera include the cause of syphilis, the ancient scourge of sexual indiscrimination, and Lyme disease, a newly discovered consequence of an innocent walk in the woods. So it is always linked with the spirochete, and it was known as the scourge of God on the people who are not doing the right things, and they are uh, sexually very different from normal people. So it is the main reason of a sexually transmitted disease known as syphilis, like Treponema pallidum, a spirochete which causes syphilis. In this image, you can see that spirochete very clearly. So a spirochete or spirochete is a member of phylum Spirochetes, which contains distinct and a diaderm, which means a double membrane, gram-negative bacteria, most of which have long helical coiled corkscrew-shaped or spiral, hence the name of this type of particular bacterial cell. So it belongs to the member of spirochete, right? And it has a double membrane structure. So, and particularly because of its corkscrew shape, the name has been given to its type is spirochete. Spirochetes are chemoheterotropic in nature, with lengths between 3 to 500 um, micrometer and diameter along 0.09 to at least 3 micrometer. So, spirochetes are distinguished from other bacterial phyla by the location of their flagella, called endoflagella, which are sometimes also called as axial filament. So its flagella is mostly present in a very different state, and it is also called around the structure of bacteria, right? And it also covers the spiral of bacteria. And here you can see that the diadem space or the double membrane space of uh, spirochete in the diagram, like outer membrane is there, and a protoplasmic cylinder is there, and flagella. You can see the location of flagella, right? So outer membrane, flagella, and the second picture you can say see the outer membrane, flagella, pre-plasmic space, peptidoglycan layer, and cytoplasmic membrane. So there is two layers of membranes that are present. Endoflagella are anchored at the end pole of the bacteria within the pre-plasmic space between inner and outer membrane, where they project backwards to extend the length of the cell. So it runs along the length of the cell, and it is always placed in between the pre-plasmic space. So the end of flagella can be easily identified as it runs around the length of the cell. These causes a twisting motion which allows uh, the spirochetes to move about. So they do not move like normal bacteria as they move normally, but they move along conducting a twisting motion. They don't move normally from A point to B point just by swimming. They move around by twisting motion. When reproducing, a spirochetes will undergo asexual transverse binary fission. So they normally reproduce by uh, binary fission or asexual transverse binary fission. Most spirochetes are free living and are aerobic, but there are numerous exceptions. Spirochetes bacteria are diverse in their pathogenic capacity and ecological niches that they inhibit. So they have a lot of variety, right? And a lot of diversity when it comes to their pathogenic nature and their ecological habitat, as well as molecular characteristics including guanine, cytosine content, and genome size. So they do have a different structure from bacteria, but they also pack a punch, having a different type of pathogenic capacity and ecological niches also. Here you can see the cross section of a spirochete cell and how the things are different. You can see that outer membrane, right? And then you can see the placement of flagella, protoplasm, inner membrane, and peptidoglycan layer also. So this is the significant blueprint of any spirochete cell, and this is how they are constructed, and this is how they operate. Coming on to the pathogenicity, many organisms within spirochetes phylum cause prevalent diseases. Pathogenic members of this phylum include the following: a Leptospira species causes leptospirosis, a Borrelia burgdorferi, uh, and Borrelia myoni, Borrelia uh, bestati, Borrelia garni, Borrelia afzeli, and so on, causes Lyme disease. Borrelia recurrentiris causes relapsing fever. Treponema pallidum subspecies which causes uh, treponematosis such as syphilis and Lyon's disease, and Brachyspira uh, p- uh, uh, piloiscoli coli and Brachyspira alborgi which causes intestinal spirochetosis. Spirochetes may also cause dementia and may be involved in pathogenesis of Alzheimer's disease. So there are several different types of conditions to which these particular type of bacteria are linked. Salvarsan, the first partially organic synthetic antimicrobial drug in medical history, was effective against spirochetes and primarily used to cure syphilis. So, salvarsan was a medicine that has been effective against finding the cure of syphilis. Additional oral spirochetes are known to play a significant role in pathogenesis of human uh, periodontal disease. So there are many types of disease to which spirochetes are linked with, like leptospirosis, Lyme's disease, relapsing fever, okay, and syphilis, yawn, dementia, even Alzheimer disease also. So when it comes to pathogenicity, they do have a lot of variety, and it shows that how dangerous they can be in reality. So although their pathogenicity has been identified, but still we do need some sort of effective medicine to deal with them. Spirochetes are morphology, classification, and disease. Spirochetes are long, thin, flexible, spirally coiled helical bacilli. Right. This is the main character that makes them different from other type of bacteria. That they are long, they are thin, they are flexible, and spiral in shape, and spirally coiled, and helical bacilli. These motile gram-negative bacilli are classified into 8 genera primarily on the basis of habitat, pathogenicity, phylogeny, morphological, and physiological characteristics. So all these things they significantly elaborate the basic behavior or the basic nature of spirochete. Although the things are based on their morphological character also and other types of characters also. These long slender bacteria are only a fraction of a micron in diameter but 5 to 250 microns long. They are tightly coiled and so, like miniature springs or telephone cords, spirochetes do not take up ordinary stains but can be stained only by silver uh, impregnation stains, except Borrelia, which is poorly gram stained. So although they have all the different type of behaviors also, but they are specially known to be gram neutral. Okay, and they do have a speciality where gram stain does not stain them properly or stain them poorly. So their diameter is in microns of 5 to 250 microns. They are tightly coiled, just like telephone cords and or like miniature springs. Spirochetes do not take up ordinary stains, but can be stained only by silver. Impregnation stains, except Borrelia, which is poorly gamsed. So they are not very much helpful when it comes to the staining process or gram staining process. Most of the genre of spirochetes are saprophytes and are widespread in aquatic environments and in animals. Saprophytes means the bacteria which feeds on dead and decaying matter or organisms, and spread especially in aquatic environments and in animals. So they are mainly found in aquatic environments. Only three genera, Treponema, Borrelia, and Leptospira, contain organisms pathogenic for humans. Okay, spirochete cause several diseases, notably syphilis, Lyme disease, relapsing fever, leptospirosis, yawns, uh, Nita, etc. The order of Spirochetes include two families of spiral bacteria, Spirochetaceae and Leptospiraceae. Orders. Family of spirochetes has four genera: Treponema, Borrelia, Spirocheta, Cheetah, and uh, Chris, uh, Christispira. And family Leptospiraceae have two genera: Leptospira and Leptonema. Differentiation of uh, genre within the family is based on the number of axial uh, fibrils, the number of insertion discs present, and biochemical and metabolic features. When it comes to the structure, what are the things that we especially observe? Spirochete mortality is conferred by flagella that emerge from each pore. So, the flagella is not at all present in a loose way in comparison to other bacteria. Flagella is somewhat twisted all around the body of that very particular organism or spirochete. However, unlike typical bacterial flagella, spirochete flagella fold back from each pole onto protoplasmic cylinder itself and remain in pre-plasmic pre-plasm of the cell. Because of this, they have been called endoflagella. So they contract, they relax, and they always present in the pre-plasmic space in between the two membranes. That is why the name of endoflagella has been awarded to them. In addition, both endoflagella and protoplasmic cylinder are surrounded by flexible membrane, the outer sheath. So, what are the things that we see here is that flagella is already present in between the two membranes of the spirochete. Here in the diagram, you can also see the same thing. Endoflagella or axial filaments beneath outer membrane and basal body. You can see these two filaments are spiring along all around the body. Right. And in the next image, you can see the DNA in the nucleoid, riboplasm, and outer membrane, and endoflagella is present in between the outer membrane and inner membrane in the space called preplasm or preplasmic space. You can see the cell wall made up of peptidoglycan and inner cell or plasma membrane. So this is the basic structure of spirochete when it comes to the definition and its characteristics. So it does move in a in different manner. Cell wall. The cell wall of spirochete is similar to the gram-negative bacteria, but differ by bearing endoflagella. It is more complex, consisting of outer membrane, pre-plasmic space containing flagella, peptidoglycan layer, inner cytoplasmic membrane. So here you can see that axial fibril, protoplasmic cylinder, outer sheath, insertion pore. So these two insertion ports are present on the two ends of the bacteria. Okay, and the twisting motion is performed by bacteria because of this flagella. And in the other picture, you can see different parts like a protoplasmic cylinder, cell wall, right, outer sheath, nucleoid, ribosome, axial fibril, and plasma membrane. Endoflagella. Endoflagella are present in preplasmic space, the space that is present in between the two membranes, uh, the outer membrane and the peptidoglycan layer. They attach to the membrane only at the pole. right? So poles at the poles you have pore from where they are attached. The number of pre-plasmic flagella varies from species to species. Endoflagella are responsible for the mortality of spirochetes. Mortality may be various types, such as uh, flexion extension type, corkscrew type, or rotatory movement, translatory type. So these are three different types of motion. So endoflagella components you can see clearly in this image, like outer membrane, cytoplasm, inner membrane, pre-plasmic space, axial filaments, right? The section view of a spirochete cell. Now, when it comes to axial filament mechanics, the opposite directional motion of axial filament allows for corkscrew motion, right? So, endoflagellum motion in preplasm depends on its outer membrane, preplasm, peptidoglycan layer, inner membrane, and endoflagellum rotates while attached to one end of the preplasmic cylinder or preplasm. So, what they were showing that were the endoflagellum components, and what they do in figure 1, a cross section of a typical spirochete cell showing endoflagella located in the preplasm between the inner cytoplasmic membrane and the outer membrane. Preplasm consists of a gel-like matrix provide a semi-stable medium to secure endoflagella during rotation. The axial filament, indicated in red, is composed of bundles of endoflagella. And what they are representing in figure 2, a side view of a spirochete cell, which shows two axial filaments in opposing motion. One axial filament rotates in a clockwise orientation, and an adjacent axial filament rotates in a counterclockwise orientation. Rotation of endoflagella creates a torsion and derives corkscrew rotation of the cell. And figure 3, what does it represent? An expanded view of cellular membrane that surrounds endoflagella. Both the inner and outer membranes contains a phospholipid bilayer with non-polar fatty acid chains inward of polar phosphorus heads. Peptidoglycan, the cell wall, provides the structure in bacterial microorganisms. Axial filaments are superior to the peptidoglycan. So the question arises now: what is the main difference between spirochetes and spirilla? So spirochetes versus spirilla. Through spirochetes and spirilla differ phylogenetically. Spirilla with many turns can superficially resemble spirochetes. In addition, spirilla do not have the outer sheath and endoflagella or spirochetes, but instead they contain typical bacterial flagella. So, spirilla-shaped bacteria do not have endoflagella. It is clearly seen in the image. The flagella are external and only connected to one end of the cell. They do not rotate as they move. So, you can see the differences between bacillus, coccus, spirillum, spirochetes, and vibrio. And you can see the basic difference in the design of spirillum and spirochete, right? Morphological differences between Treponema borrelia and Leptospira. The size, Treponema is having size of 6 to 14 micrometer. Borrelia is having size of 10 to 30 micrometer, and Leptosporia having size from 6 to 20 micrometer. Spiral numbers, uh, in Treponema you have 6 to 12, Borrelia you have 3 to 10, and Leptospira you have numerous and tightly coiled with hooked ends. Wavelength 1 micrometer, 3 micrometer, and 0.5 micrometer. Amplitude of spiral is 1 to 1.5 micrometer in Treponema, Borrelia up to 2 micrometer, and Leptospira up to 0.1 micrometer. Endoflagella of each pole is Treponema is 3 to 4, and Borrelia is 7 to 11, and Leptospira is just 1. So, a disease caused by various genus of spirochetes. Spirochetes disease and transmission, like Treponema, Palladium causes syphilis, transmission by sexual contact, and Treponema, uh, pertine, pertineo, yawns, direct contact, Treponema, Caritium, Pineta, direct contact, Borrelia burgdorferi, Lyme disease, tick-borne, Borrelia recurrentis with lapsing fever, louse-borne, uh, Borrelia bessentii, angina, direct contact, and Leptospira interrogans, leptospirosis, severe form of Wales disease, contact with rodents' urine. Now coming on to syphilis. Syphilis is a bacterial infection usually spread by sexual contact. The disease starts as a painless sore, typically on your genitals, rectum, or mouth. Syphilis spreads from person to person via skin or mucous membrane contact with these cells. So, after the initial infection, the syphilis bacteria can remain inactive or dormant in your body for decades before becoming active again. Early syphilis can be cured sometimes with a single shot injection of penicillin. Without treatment, syphilis can severely damage your heart, brain, or other organs, and can be life-threatening also. Syphilis can also be passed from mothers to unborn children. So here in the image you can see the three stages of syphilis, and risk factors are engage in unprotected sex, have sex with multiple partners, uh, are a man who has sex with men, are infected with HIV, the virus, and other that causes AIDS. So here you can see in stage one the source, 3 to 90 days after exposure, and syphilis is a bacterial infection usually spread by sexual contact. The bacteria starts as a painless sore, typically in your genitals, rectum, or mouth, and stage two, a body rash that appears after 4 to 10 weeks after exposure, and infection caused by bacterium Treponema pallidum, that is a type of spirochete, and stage 3 after internal affects internal organs, and 3 to 15 years after exposure. Symptoms. Syphilis is a bacterial infection that typically spreads through sexual contact. The first sign of syphilis is most commonly a painless sore called canker that develops where the bacteria entered the body. The canker typically appears within 3 weeks from the time of exposure. It is usually in the area of genitals, rectum, or mouth, and it can go unnoticed if it is hidden inside the body. The infection spreads from person to person when a person touches these sores with their skin or mucous membrane. Syphilis can be difficult to diagnose because after the initial infection, The bacteria lie dormant in the body for years before becoming active again. With no visible symptoms, the only way to know that you have syphilis is to be tested for it, which usually involves a blood sample taken according to lab test. Syphilis can be a serious, even life-threatening illness if it goes untreated. It's especially dangerous when passed from an infected mother to her infant during pregnancy or childbirth. With the number of cases of syphilis, including congenital syphilis, on the rise in United States and elsewhere in the world, the Centers for Disease Control and Prevention is recommending annual or even more frequent screening for those individuals at high risk. And numerous states and local health departments are mounting awareness campaigns. Fortunately, there are several very effective treatments available to kill the bacteria that cause syphilis, and the infection is easily curable in adults when treated early. It can be treated at later stages as well as, but treatment cannot reverse any organ damage the disease may have already caused. Causes. The causes of syphilis is bacterium called Treponema pallidum. The most common route of transmission is through contact with an infected person's source during sexual activity. The bacteria enters your body through minor cuts or abrasions in your skin or mucous membrane. Syphilis is contagious during its primary or secondary stages, and sometimes in the early latent period. Less commonly, syphilis may spread through direct unprotected close contact with an active lesions, such as during kissing, or through infected mothers to their babies during pregnancy or childbirth. That comes under congenital syphilis. Syphilis cannot be spread using the same toilet, bathtub, clothing, or eating utensils, or from doorknobs, swimming pools, or hot tubs. Once cured, syphilis does not recur on its own. However, you can become reinfected if you have contact with someone syphilis sore. Stages of syphilis. Primary syphilis. The first sign of uh, syphilis is a small sore called canker. The sores appear at a spot where the bacteria entered your body. While most people infected with syphilis develop only one canker, some people develop several of them. The canker usually develops about 3 weeks after exposure. Many people who have syphilis don't notice the canker because it's usually painless, or it may be hidden inside or hidden within the vagina or rectum. The canker will heal on its own within 3 to 6 weeks. So here you can see different stages of syphilis: primary, secondary, latent, and late tertiary. So what will happen in primary? The chance the canker lesion is a hallmark of primary syphilis. It may appear from 10 to 90 days after exposure. Commonly include penis and labia. Other sites include anus, oral mucus. Without treatment, canker disappears in 2 to 8 weeks. Secondary stage of syphilis include a rash, pink to brown macules, involves palms, soles in 50% of cases. Oral lesions called mucus patches resembling snail tracks. Symptomatic early neurosyphilis and Other oral nerve defines aseptic meningitis presentation. Oral ocular syphilis maintenance include anterior and posterior uveitis. So there are different stages. Latent and tertiary phases are there. Latent refers to asymptomatic infection after the period of primary and secondary syphilis has passed. Right. So early latent refers to a, asymptomatic patients with positive testing in whom history can confirm exposure to or symptoms of primary secondary syphilis within the last year. This group may receive a single dose of penicillin like primary or secondary. So, and tertiary, late neurosyphilis, including TBs and GIAT impairments and dementia, TBs dorsalis damages the dorsal column and sensory nerves roots, causing syndrome of pain and sensory defects similar to those of B12 deficiency. So, in the later period, it does cause some internal damage to the organs. Secondary syphilis. Within a few weeks of the original canker healing, you may experience a rash that begins on your trunk but eventually covers your entire body, even the palms of your hands and soles of your feet. The rash is usually not itchy and may accompanied by wart-like sores in your mouth or genital area. Some people also experience hair loss, muscle aches, a fever, sore throat, or swollen lymph nodes. These signs and symptoms may disappear within few weeks or repeatedly come and go for as long as a year. Latent syphilis. If you are not treated for syphilis disease moves from secondary stage to the hidden latent stage when you have no symptoms. Latent stage can last for years. Signs and symptoms may never return, or the disease may progress to the third tertiary stage. Tertiary syphilis. About 15 to 30% of people infected with syphilis who do not get treatment will develop complications known as late or tertiary syphilis. In the late stage, the disease may damage your brain, nerves, eyes, heart, blood vessels, liver, bones, and joints. These problems may occur many years after the original untreated infection. Neurosyphilis. At any stage, syphilis can spread and among other damage, cause damage to the brain, nervous system, neurosyphilis, and the eye, ocular syphilis. Congenital syphilis, babies born to women uh, who have syphilis can become infected through the placenta or during birth. Most newborns with congenital syphilis have no symptoms, although some experience a rash on the palm of their hand and the soles of their feet. Later signs and symptoms may include deafness, teeth deformities, and saddle nose, where the bridge of the nose collapses. However, babies born with syphilis can also be born too early or be born dead, stillborns who die after birth. Test and diagnosis. A doctor will carry out physical examination and ask about a person's sexual history before carrying out clinical tests to confirm syphilis. Tests include blood tests. These can detect a number or past infection as antibodies to the syphilis bacteria be present for many years. Bodily fluids. A doctor can evaluate fluid from a canker, during the primary or secondary stage. Cerebrospinal fluid. Doctor may collect this fluid through a spinal tap and examine it to monitor the disease effects on the nervous system. If the person receives a diagnosis of syphilis, they must notify any sexual partners. Their partners should also undergo testing. Local services are available to notify sexual partners of their potential exposure to syphilis, enable testing, and, if necessary, administer the treatment. Prevention. Measures to decrease the risk of syphilis include abstaining from sex, maintaining long-term mutual monogamy with a partner who does not have syphilis, using a condom, although these only protect against genital sores and not those that develop elsewhere on the body, using a dental dam or plastic square during oral sex, avoiding sharing sex toys, refraining from alcohol and drugs that could potentially lead to unsafe sexual practices. Having syphilis once uh, does not mean that person has protection from it going forward. Even after treatment has successfully removed syphilis from the person's body, it is possible for them to contract it again. So, what treatments are available for syphilis? The recommended treatment at all stages of this disease is the antibiotic penicillin. So, if you have been infected for less than a year, you may need just one injection of penicillin to be cured. But you may need more doses if you have had syphilis for more than a year. There are no over-the-counter medications or home remedies that will cure syphilis. Only antibiotics can do that. So coming on to the MCQs, Endophilella present in which class of bacteria? Spirilla, spirochetes, bacillus, coccus. The correct answer is spirochetes. Where is the endoflagella located in spirochetes? In the cell membrane, in the cytoplasm, in the peptidoglycan layer, in the pre-plasmic space. The correct answer is in the pre-plasmic space. Spirochetes, like other bacteria, swim best in media of low viscosity. True or false? False. Which of the following methods is used for viewing spirochetes? Bright field microscopy, phase contrast microscopy, dark field microscopy, electron microscopy. The correct answer is dark field microscopy. The family of Leptospiraceae are aerobes. True or false? False. Which of the following are uh, microaerophilic bacteria? Spirochaete, Cristospira, Treponema, Borrelia. The correct answer is Borrelia. Which of the following bacteria causes syphilis in humans? Treponema dysentery, Treponema pallidum, Leptospira biflexa, Leptospira interrogans. The correct answer is Treponema pallidum. Which of the following have bipolar tufts of flagella? Aquaspirillum, Azospirillum, Cristispora spira, Borrelia. The correct answer is Aquaspirillum. Which of the following causes diarrhea in humans? A. Lipofilum, L. Interrogans, C. Jejuni, or E. coli. The correct answer is A. Lipofilum. Which genus among the following has uh, certain similarities to the genus Bordoviro? Azospirillum, Oceanospirillum, and Campylobacter vam- Vampiro vibrio. The correct answer is Vampiro vibrio. So these are the references from where we have collected the material. And thank you very much for listening to my lecture.